Polio. Poliomyelitis, often called polio or infantile paralysis, is an infectious disease caused by a virus. This virus is a member of the enterovirus subgroup of the Picorno Variday family and has three serotypes PV1, PV2 and PV3. Picorno Variday 1, Picorno Variday 2 and Picorno Variday 3. The tissue most commonly affected is the spinal cord, which leads to the classic manifestations of paralysis. Polio is a terrible disease and children who get it cannot walk. Epidemiology. As a result of a massive global vaccination campaign over the past 20 years, polio exists only in a few countries in Africa and Asia. In the Philippines, the last polio case was recorded in 1993, and in 2000 the Philippines was certified polio-free by UNICEF. Person-to-person transmission occurs of polio, and spread of polio virus is through the fecal or oral route, which is the most important route of transmission, although the oral route may account for most of the cases. And the risk factors: infants and elderly are affected with polio. Compromised immune system, lack of immunization against polio and extreme stress are the reasons for attack of this polio virus. Travel to an area that has experienced a polio might be one of the reasons for transmission of this PV1, PV2 or PV3 viruses, Picorno Variday viruses. The mouth is the portal of entry of the virus, and primary multiplication of the virus occurs at the site of implantation in the pharynx and gastrointestinal tract. The virus is usually present in the throat and in the stools before the onset of illness. 1 week after onset, there is little virus in the throat, but virus continues to be excreted in the stools for several weeks. The virus invades local lymphoid tissue, enters the bloodstream, and then may infect cells of the central nervous system. Replication of poliovirus in motor neurons of the anterior horn and brainstem results in cell destruction and causes the typical manifestation of poliomyelitis. Paralytic polio is classified into 3 types. They are spinal polio, bulbar polio and bulbospinal polio. Spinal polio, the most common and accounted for 79% of paralytic cases from 1969 to 1979. It is characterized by asymmetric paralysis that most often involves the legs. Bulbar polio accounts for 2% of cases and leads to weakness of muscles innervated by cranial nerves. The bulbospinal polio, it accounts for 19% of cases and is a combination of bulbar and spinal paralysis. The incubation period for poliomyelitis is commonly 6 to 20 days, with a range from 3 to 35 days. The response to poliovirus infection is highly variable and has been categorized based on the severity of clinical presentation. And pathogenesis, what is observed, that is flaccid paralysis, weakness or paralysis and reduced muscle tone. And based on the polio, there are different scenario. What is observed: abortive poliomyelitis, where you get sore throat, abdominal pain, constipation or diarrhea, nausea, decreased appetite once the virus is present within the gastrointestinal tract, and this may also lead to upper respiratory tract infection and fever. Pain, fluid volume deficit, imbalanced nutrition, less than body requirement, fatigue, hyperthemia are the conditions that are noted in abortive poliomyelitis. In non-paralytic poliomyelitis, stiffness of the neck, back and or legs followed by pain and hyperthermia occur, whereas paralytic poliomyelitis, severe muscle aches and spasms in the limbs and back, flaccid paralysis, this leads to flaccid paralysis, loss of superficial reflexes, diminished deep tendon reflexes, weakened breathing, flushed or blotchy skin. And this brings about disturbed body image, risk for injury, self-care deficit, and impaired breathing pattern. Virus culture is done for diagnostic studies. The laboratory diagnosis of polio is confirmed by isolation of virus by cultures from the stool or throat swab or cerebrospinal fluid. In an infected person, the virus is most likely to be cultured in stool cultures. In the serological test, acute and convalescent serum sample may be tested for rise in antibody titer, but the report can be difficult to interpret as in many cases the rise in titer may occur prior to paralysis. And cerebrospinal fluid test, infection with poliovirus may cause an increased number of white blood cells and a mildly elevated protein level in cerebrospinal fluid. Treatment of pain with analgesics such as acetaminophen, antibiotics for secondary infection, fluid therapy, bed rest until fever is reduced, adequate diet, minimal exertion and exercise, hot packs or heating pads for muscle pain, prolonged rehabilitation may be necessary including braces, splinter, surgery for making the person walk. Hospitalization may be required for those individuals who develop paralytic poliomyelitis. If the respiratory is involved, long-term ventilation is necessary. Physiotherapy may be necessary. Place the child on firm mattress with support for feet, change position frequently. Encourage oral intake of food and fluid, and catheterization of distended bladder may be necessary. The best preventive measure for poliomyelitis is ensuring hygiene and encouraging good sanitation practices. But polio prevention begins with polio vaccination, and this polio vaccination is being done consequently for few years in our country. And polio vaccine has been developed against all three subtypes of the polio virus and is very effective in producing protective antibodies that induce immunity against the polio virus and provides protection from paralytic polio. And polio vaccines, there are different types of polio vaccines. The inactivated polio vaccine, it is inactivated, so it cannot be replicated and cannot be shed in the stool of a vaccinated person. It cannot cause vaccine associated paralysis and is safe to use in immunodeficient persons or in household contacts of immunodeficient persons. Requires injection, more expensive, produce less local gastrointestinal immunity. Recipients could become infected with wild polio virus. Oral polio virus or the OPV, it is very easy to administer. It is given orally, less expensive, produces excellent intestinal immunity which helps prevent infection with wild virus, may cause vaccine associated paralytic polio. And this vaccine is always given oral, site is mouth, number of doses 3 doses, and usually aged at first dose, that is 6 weeks after birth. Minimum intervals between doses 4 weeks and dosage is 2 drops. Storage temperature is -15 to